Welcome to this explainer. Today, we're jumping right into a literally revolutionary concept from the world-renowned psychiatrist and brain health expert, Dr. Daniel Amen. For a really long time, we've treated physical pain and emotional pain as if they're two completely different problems, right? But Dr. Amen's extensive research reveals something just absolutely incredible. Physical and emotional pain actually run on the exact same circuits in your brain. This means we need a fundamental shift in how we approach our health because, well, quite simply, you cannot heal your body without healing your mind.
Okay, let's dive into this. Dr. Amen uses this fascinating biofeedback test with his patients that perfectly demonstrates this mind-body connection. He hooks patients up to sensors that measure hand temperature, sweat, and heart rate, and then plays a simple word association game. For Dr. Amen himself, when he hears a comforting word like mother, his hands immediately get warmer, his breathing slows down, and his heart rate variability improves. But when he hears a loaded, stressful word for him, like father, the physical response is instantaneous. His hands get colder, they get sweatier, his muscles tense right up, and his breathing becomes fast and shallow. It's wild. This proves a really powerful reality. Every single thought you have impacts every cell in your body, moment by moment.
And this leads us to a massive mind-body shocker. Research actually shows that 80% of 71-year-olds who have absolutely zero back pain actually have abnormal back MRIs. Think about that for a second. If you look at their scans, they might have arthritic or crushed discs that look like they require immediate surgery, but they don't feel any pain. This proves that if you put your body in a healing environment, which absolutely starts with a healthy brain, your body figures out how to heal and work around those structural issues. And this is totally crucial because it can help people avoid unnecessary surgeries and dangerous general anesthesia, which itself is a massive risk factor for cognitive decline.
Section 1. The Brain Pain Connection. Stop flying blind.
So, despite this profound connection between the brain and physical healing, our modern medical industry is kind of missing the mark by entirely focusing on symptoms. Let's look at the field of psychiatry. Back in 1840, when Abraham Lincoln was deeply depressed and suicidal, his doctor diagnosed him simply by talking to him, looking at him, and identifying a cluster of symptoms. Insanely, 185 years later, the standard practice hasn't changed. Today, doctors write 340 million antidepressant prescriptions a year based solely on patient-reported symptom clusters, all without ever scanning the physical organ they're actually treating. It's basically the equivalent of a cardiologist giving everyone the exact same pill for chest pain without ever checking their heart. They're flying completely blind.
Part 2. Trapped in the doom loop.
Let's move to and see how this builds. Because the medical system ignores the physical health of the brain, millions of people find themselves trapped in a vicious, self-destructive cycle. It starts with pain for any reason at all, physical or emotional. This pain activates the feeling pathway in your brain. That triggers the suffering pathway to turn on. Once that suffering pathway is active, your nervous tension rises, which physically increases the pain in your body. To cope with this rising tension and pain, people naturally turn to harmful habits to numb themselves. Things like alcohol, marijuana, or highly processed foods. But these bad habits just damage the brain further, putting you right back at the start of the loop with even more pain and suffering.
A major driver of this doom loop is an invasion of what Dr. Amen calls ANTs, or automatic negative thoughts. This is that cynical, pessimistic internal chatter that just invades our minds. Here's why ANTs are so physically dangerous. Your prefrontal cortex is the executive center of your brain, and it's responsible for sending signals to the rest of your body to turn off pain. But large-scale imaging studies show that chronic negativity actually decreases activity in the prefrontal cortex. That means these negative thoughts are literally stopping your brain's ability to switch off your body's pain signals. They're literally preventing you from healing.
Part 3. Repressed rage and trauma.
But the negative thoughts aren't always right there on the surface. There's a pretty counterintuitive truth about chronic pain. It very often occurs in good people suffering from deep, repressed rage and childhood trauma. And modern environmental factors are heavily amplifying this underlying pain, especially for younger generations. Youth suicide has skyrocketed an absolutely staggering 746% since the year 2000. Why? Well, because the modern environment is filled with dopamine destroyers. Cell phones, fast food, negative news, and social media constantly wear out the brain's pleasure centers. When that part of the brain is exhausted, people feel entirely flat, hopeless, and devoid of drive, deeply exacerbating their emotional trauma.
Releasing this underlying trauma and rage is absolutely essential so it doesn't manifest as chronic physical pain. Dr. Amen suggests some highly actionable solutions for this. One is emotional freedom journaling, where you create a timeline in 5-year increments and actively write down both the awesome and the awful things that happened, helping you locate exactly where the rage started. He also points to therapies like EMDR, which uses eye movement to soothe the nervous system and take the trigger away from traumatic memories, and ISDP, a therapy designed to help you safely act out and process repressed anger so it finally leaves your body.
Part 4. Everyday toxins destroying brains.
Beyond emotional trauma, we really have to look at the tangible, everyday choices people make that unknowingly damage their brain health, literally shrink their brains, and keep them trapped in that doom loop. Let's start with alcohol. For decades, we were told a glass of wine is a health food, right? Well, the scans show that's simply a lie. Drinkers have brains that look older than their actual age. The human gut contains 100 trillion healthy bugs, your microbiome, which make neurotransmitters and are absolutely critical for your mental health. As Dr. Amen points out, alcohol is literally a disinfectant. When you drink it, you are essentially pouring hand sanitizer all over your healthy microbiome, destroying the very environment your brain relies on to function properly.
And this brilliantly illustrates the hidden dangers in what we consume, artificial sweeteners. Dr. Amen himself suffered from severe chronic arthritis in his 30s. He cured it entirely just by quitting the massive diet sodas he drank every single day. Aspartame doesn't just cause physical joint pain, it actually has terrifying mental health implications. Recent studies show that giving mice aspartame not only made them highly anxious, but it created epigenetic changes. Their babies, and even their grandbabies, were born anxious without ever consuming the sweetener themselves. Crazy, right?
Then there's marijuana. Despite its massive popularity for pain management, a study of 1,000 marijuana users showed decreased blood flow and activity in virtually every single area of the brain, significantly impacting learning and memory areas. It offers a short-term escape that creates long-term damage, increasing the risk of anxiety, depression, and psychosis. Take NBA star Julius Randle, who was using pot to escape negative thoughts and past trauma. It was ruining his personal relationships. But the moment he actually saw the damage on his brain scan, he quit entirely, saving his marriage, transforming his mindset, and going on to have the best playoffs of his career.
Part 5. The Whole 4 Framework.
Look, you cannot just fix your diet or just go to therapy and expect true healing. Dr. Amen developed the Whole 4 framework because optimal health requires a comprehensive approach. Right now, society is in a serious crisis because we're failing in all 4 of these vital areas simultaneously. To truly heal, we have to optimize our biology, the physical health of the brain and body. We have to train our psychology and our mind. We must nurture our social connections, as we are lonelier than ever. And finally, we have to address the spiritual aspect, our relationship with faith, meaning, and purpose.
That spiritual pillar is incredibly powerful, yet it's so often ignored by science. The data actually shows that lacking a belief in God or feeling that your life has no higher purpose triples your risk of depression. On the flip side, brain scans reveal that believers often have larger temporal lobes. That's the part of the brain involved in spiritual experiences. Furthermore, studies indicate that people who regularly attend church and have a strong faith community actually recover from physical illnesses significantly faster.
Part 6. Training your mind to heal.
So how do we put this into practice? How do we take control of the mind so the body can follow? Dr. Amen's core philosophy here is skills, not just pills. You have to train your brain exactly like you would a muscle. The first highly actionable step is to give your mind a name. This creates vital psychological distance from the constant internal noise. For example, Dr. Amen named his mind after a pet raccoon he had growing up because it was a constant troublemaker that left a mess everywhere. Julius Randle named his mind after a randomly barking dog named Teddy. By naming it, when a storm of negative thoughts arrives, you realize it's not you, it's just the raccoon or the barking dog, and you don't actually have to listen to it. So, the crucial point is, you must actively talk back to these thoughts. When an automatic negative thought arrives, write it down and identify it. Is it all or nothing thinking? Is it blaming someone else? Then actively question it. Ask yourself, is this thought absolutely true? Take the mothership thought that plagues humanity. I am not enough. If you flip that to its exact opposite, I am enough, and actively look for hundreds of simple examples in your daily life where you provide value, you literally rewire your brain to reject the negative chatter.
The physical difference between leaning into negativity versus gratitude is entirely visible on a brain scan. Chronic negativity and complaining actually shrink the brain and significantly increase your risk of dementia. Gratitude, on the other hand, acts exactly like deep meditation or prayer. Taking time to notice the little miracles in your day actively calms the amygdala, the fear center of your brain, while simultaneously activating and strengthening your prefrontal cortex. Everything we've covered today points back to this profound truth from Dr. Amen. You can't cure disease without also curing the soul. Because the networks that control your brain are inextricably linked to the networks controlling your organs, you can't just treat the physical symptom. True freedom from physical and emotional pain demands that we protect our brain's physical health, process our deep-seated trauma, and nurture our spiritual well-being.
We've seen the scans, the statistics, and the undeniable connection between the mind and the body. You are not at the mercy of your physical pain, and you are not a victim of your runaway mind. You have the tools to break the doom loop. So if it is a biological fact that every single thought you have immediately impacts every cell in your body, what will your next thought be?